How is it none of you have ever seen smallpox in your lifetime? To be honest, the answer is an amazing story, a story I promised to share in the last lesson of this course. Okay, a promise is a promise, remember? Today, smallpox no longer exists. How, you ask? Let's go back 200 years. At the age of 24, Edward Jenner set up practice as a family doctor in Gloucestershire, England. Smallpox was among the common ailments he treated. Curiously, he noticed that milkmaids, for some reason, rarely got smallpox. Instead, they often contracted cowpox, a similar but milder disease that produces blisters that readily heal. Could cowpox be protective against deadly smallpox? In order to test this idea, on May 14, 1796, Jenner scraped the pus from a fresh cowpox blister off the hands of a local milkmaid, Sarah Nelms, and inoculated young 8-year-old James Phipps, the son of Jenner's gardener. Little James developed mild fever and soon fully recovered. Then, on July 1st, Jenner put his idea to the test. Jenner took pus from a genuine smallpox patient and inoculated young Phipps. James Phipps seemed to be resistant to the human disease, but just to be sure, Jenner challenged Phipps a few more times, each time obtaining the same result. Inoculation with cowpox protects against human smallpox. And so, vaccination is born. Since Jenner, smallpox vaccination campaigns were initiated worldwide, and with each, the prevalence of smallpox dropped. Finally, in 1966, the 19th World Health Assembly initiated a global smallpox eradication program, and the eradication of smallpox was officially certified by the WHO in 1980. So, contracting cowpox protects us against smallpox. When we are vaccinated, our immune system trains against the cowpox, perfects antibodies and T cells, and stores memory cells, experienced in the fight against the milder disease. However, in the event of a genuine smallpox attack, thanks to cross-reactivity, our memory is triggered and anti-cowpox immunity proves sufficient to prevent and knock out the human virus. Smallpox is not the only amazingly successful vaccine. Polio is also just about beat. As you recall, Roosevelt's March of Dimes was devoted to producing a vaccine. Enders and his team discovered how to grow poliovirus in tissue culture. Then, Jonas Salk, a young medical researcher at the University of Pittsburgh, developed a method to mass-produce killed poliovirus for vaccination. Killed virus, you ask? How can you kill something that isn't even alive in the first place? When viruses are treated with chemicals that damage their genes or distort their proteins so that they can no longer infect cells and replicate in them, folks refer to these inactivated viruses as killed, metaphorically, of course. And when viruses can infect cells and replicate in them, these same folks call these infectious particles live viruses. Live, dead, or killed, and weakened or attenuated, as we will see, are common terms the public uses to describe the infectious state of viruses used in vaccines. Salk discovered that treating infectious live viruses with formaldehyde inactivates them, and although their antigenic surfaces look normal, the viruses are unable to infect cells or replicate at all. Thus, injecting formaldehyde-killed poliovirus into people gives our immune system plenty of time to study the viral proteins, expand B-cell clones that perfect anti-polio antibodies, and store memory cells, all in the absence of disease. Now, some of you may ask, antibodies are fine, but what about T-cell immunity? If the virus is inactivated and unable to infect and replicate in cells, there's no new production of viral proteins, and MHC reporters don't make it to the cell surface to activate T cells. For this, Albert Sabin took an alternative polio vaccine approach. Sabin grew poliovirus a human pathogen, in cultures of monkey cells at suboptimal conditions. Doing this over many generations drove the viruses to mutate and adapt to actually prefer monkey over human cells. When these modified viruses were administered to people, they infected them, but no longer caused disease. The viruses were weakened, that is to say, attenuated. Taking a few drops of live attenuated virus, Sabin's oral polio vaccine, OPV, infects our mucosa with harmless viruses and gives our B cells and T cells a chance to train. In the event of a genuine polio infection, memory is called in to the rescue, and disease is prevented already in our gut. So, vaccination gives our immune system the time and opportunity to train and practice on killed, attenuated, or cross-reactive harmless viruses. Then, in the event we encounter genuine virulent viruses, we respond immediately with a full-blown, strong, and effective secondary response and eliminate the threat before disease develops. It appears that all is good. However, this is not the whole picture, and risks do need to be considered. We will address these in a coming unit, but only after we've learned a little more about vaccines.